Hey there, everybody. Welcome to another episode of The Whole Truth. Today I'm here with my guest, Anna Diaz, who works with me at Dr. Rogers Centers, and she is our stem cell therapy coordinator. And so she's here, obviously, so I can share something that we are both so excited and passionate about right now, and that is stem cell therapies. Because as you may or may not know, the therapy of the future is here today and available for a lot of conditions. So I'm so glad that you could join me, Anna.
Thank you for having me.
Time and all your expertise, because you are kind of spearheading everything. You're the first point of contact for patients who call and want to have their consult about what it is we're doing. So I'm happy to give a little bit of overview in a second, or if you, and then we'll talk about the process. So stem cell therapies are controversial in America because of all the issues surrounding them, and people still have an idea that when we're talking about stem cells, that we're talking about fetal or embryonic stem cells, and we are not. That's the first thing that we want to make clear.
Absolutely.
We're working with people's own stem cells that we have in our bodies. All of us have them, and now we can harvest them in a mini liposuction because they're latent in the fat, lying dormant, waiting to respond when we need them. But now there are techniques that are available where we can activate them, process them, and then re-administer them to patients. So what are some of the conditions that patients might seek stem cell therapies for?
So there's a variety of medical conditions that people come to us who are needing help with. So we have everything from osteoarthritis, so that means less cartilage in the knee joints, shoulder joints. We have people who come to us with torn meniscus, torn ACLs, different ligament issues.
Hips, backs, pain, inflammation, and osteoarthritis is one of the most common causes of disability in the aging population, and most of the time patients are told there's really no treatment for it. Age-related, you just have to suffer, take pain medications when you can, hopefully lose weight, do things like that to optimize your recovery and to decrease the stress on the joints. But stem cells present a new option that can really provide people with some genuine healing and regeneration sometimes of tissues that are being worn out. So it's an exciting therapy. We do it in our office. What other things do we need to let the patients know about these stem cell treatments?
So we can do anything from osteoarthritis to autoimmune diseases. So that includes lupus, rheumatoid arthritis, Sjogren's, psoriasis.
Yep.
We also can help neurological diseases, so multiple sclerosis, Parkinsons, Alzheimer's. We also have urology issues like erectile dysfunction, pulmonary conditions like COPD has very wonderful results in many of our patients.
Absolutely. And these therapies, it's important for everybody to know that they're still considered investigational in the United States. And so one of the features of our program is that we work with a company, and our therapies are being monitored. We are working under nationally approved IRB protocols. That stands for Institutional Review Boards. So whenever something is being done that's investigational or research, it's being monitored very carefully for safety, for outcomes, for results, and it's very important for investigational therapies to be under a research protocol, because otherwise there's a higher risk to patients of bad outcomes and rogue clinics doing maybe things that don't have as much science supporting their particular sources and utilization. So we're very proud to be part of this huge investigational therapy, and hopefully we'll be able to contribute to the growing data, like Anna was saying, that shows very promising outcomes for patients. Tell me again, these conditions that you mentioned are often the difficult to treat ones where medicine, conventional therapies fail patients, and we are just kind of told, sorry, we've tried these things, they haven't really helped. Now people with COPD have to live with oxygen tanks, have minimal function. But for COPD, what are some of the outcomes that patients have experienced, the benefits with breathing and such from stem cell therapies?
Sure, so about 90% of the patients have noticed an increase in oxygen levels as well as a decrease in fatigue. So that's helping their everyday life.
Absolutely.
What most patients notice, whether it's COPD, osteoarthritis, RA, most patients are noticing a decrease in inflammation in their body within 48 hours after the stem cell deployment.
Wow.
So that also goes for patients with COPD. There's a decrease in inflammation in their lungs within about 48 hours. And some patients are even noticing the ability to get off of their medications within 3 to 6 months.
Wow, that's life-changing for people suffering from these conditions that are so altering. I mean, if you have COPD, a lot of the times that means that you can barely leave your home, and when you can, you have to be with an oxygen tank at all times. How stem cells do their work in our bodies is really fascinating, and without getting too technical about it.
Or sciencey.
Exactly. We don't want to scare anybody off, but science, for some of us, science is fun and exciting, and that would be us. But stem cells are what our body uses to repair damage and injury every day in anything that happens in our tissue. And so stem cells are a special type of cell that possess some properties that the other cells don't have. So for example, my lungs are specialized. Lung cells know what they have to do. They have to filter oxygen and excrete carbon dioxide. Muscle cells know that they need to pump things. Cartilage cells need to be able to cushion things. Stem cells are just lying in kind of an immature state. They don't have a function. They're not doing anything yet. And they can make more copies of themselves. But when they recognize an injury, if I fall and skin my knee and I've got road rash or an injury, the stem cells in that area recognize the special distress signals released by damaged skin or a torn muscle, and they respond to it, and they're able to turn into new skin cells. That's how you heal when you fall off your bike and skin your arm. The way that the skin grows is through the effects of stem cells turning into a new tissue. They can what's called differentiate into, for the type of cells we're using, fat, muscle, cartilage, bone, nerve,
fat cells, tendons and ligaments, and then whenever it creates new types of cells, it adds in additional blood vessels, so that that area of your body is getting an increase in oxygen, increase in nutrients from that new development of those stem cells.
So this is kind of, I think, in my opinion, real healing, right? Sometimes in medicine, all we do is treat a symptom with a Band-Aid or a patch, but this is something that will really regenerate tissue. And so that's what we're both passionate about, regenerative medicine and helping people to actually heal from conditions. Some of these other ones that you mentioned, neurodegenerative conditions, Parkinson's, multiple sclerosis, ALS, very difficult to treat conditions where the treatment options are not offering wonderful improvements. So for some of these, what are our company's documented results with our Parkinson's
So
patients?
Parkinson's has about a 65% success rate. Multiple sclerosis has about a 74% success rate.
Yes.
So that means patients are noticing greater strength, greater mobility, greater balance, a decrease in joint stiffness and limb heaviness. They're also just kind of helping them day to day. And so this is looking to help slow down the effects of their neurological conditions.
Absolutely. It's phenomenal. What are the other things that we talked about? The autoimmune conditions.
Yes, those have amazing results. Now, Dr. Askew can speak to her experience, but
I will.
Some of our other patients with rheumatoid arthritis, with lupus, with Sjogren's, RA has an 87.5% success rate. That's one of our highest.
Extraordinary.
Yes.
And that goes to another property of stem cells, is that they possess the ability to modulate our immune system. So people who suffer from autoimmune conditions like myself, or our patients who've been treated for, been managed with rheumatoid arthritis, lupus, and Sjogren's, we have hyperactive immune systems that have lost their regulation and started to attack our native tissue. So for me, with a condition called psoriasis, where I have had plaques covering my legs and arms and up to 80% of my body when it is at its worst, controlled with injectable medications. But after I did my stem cell therapy,
Back in October, right?
Back in October. So when I last talked about it, I said we were at 4 months, but I think now we're at close to 5 that I have not had to give myself an injection of a medication to tone down my immune system, because the stem cells have done it. So I haven't needed a shot. My psoriatic arthritis hasn't flared, and my skin is still clear. So with autoimmune diseases, we don't know if it's going to be a one-time therapy and then it goes away forever. I wouldn't expect that, because something within my immune system is dysregulated. And so in the future, if it recurs, there's a program that's available to patients where we can not only harvest their cells, but store them. Tell us a little bit about Cells on Ice, if you will.
So Cells on Ice is in partnership with Cell Surgical Network, which is the stem cell organization that we're affiliated with. So what Cells on Ice can do is we would harvest an additional amount of fat tissue. We would process it down to the mesenchymal stem cells, and we would bank those stem cells in the Cells on Ice laboratory. And so what they would do is they would hold them there. They can expand it to hundreds of millions if needed. And then at any time a patient needs a second deployment. So we know with COPD that patients are going to most likely need 2 to 4, depending on what level and what stage that they are. How you touched on with autoimmune, you know, the body's continuing to attack itself. So there is a good chance of a second deployment, whether that's 6 months later, 6 years later, it all depends on the patient. Another one would be neurological conditions like MS. There is a good chance that they would need multiple deployments. So instead of having the patient come in each time to have the liposuction done, cell processing in our office, and then to deploy it that way, we could bank and expand those cells in the Cells on Ice laboratory, and then all we do is we give them a call. They go ahead and send us the patient's stem cells. Again, it's your own stem cells from your fat tissue. So we're able to get that patient's stem cells. And what's really interesting is, so I am 30. If I bank my stem cells at 30, they will always be 30 years old.
Exactly.
So if I need them when I'm 60, when I'm 90, if I have a stroke, if I have a heart attack, if I get into some kind of auto collision and I have a spinal cord injury, we can call Cells on Ice. They can send us my own stem cells that I banked, and then they can deliver them to me through an IV, or depending on what the protocol is, then they can deliver them to me so that my body is able to heal itself more quickly when I'm in such a sensitive state.
It's extraordinary. To me, this is the really exciting part, that I think this is the best insurance policy available, because, you're young, I'm old, but I still have some stem cells, so I'm planning on harvesting some more cells and sending them off and baking them, because, you know, cardiovascular disease is the biggest killer, 1 in 3, and the stem cells show tremendous promise. When we suffer a heart attack and that part of our heart scars and doesn't function properly and we develop congestive heart failure, the stem cells can be administered. Most of the time we are doing IV treatments, I'm going to talk about that in a second, but they will recognize the damage going on in my heart and can undo that scarring and allow normal functioning. The similar effects with strokes. So rather than remaining paralyzed, there are incredible stories out there of research protocols where patients who had suffered strokes and couldn't move, were paralyzed, were administered stem cells in various regions and on protocol, and within a day were able to move and speak and regain function that they had lost due to their stroke. So these therapies are so exciting. They are still being tested, and I just think it's the most exciting thing going on in medicine by a large measure. I wanted to touch on we talked about my psoriasis. How we usually do for people who are getting a one-time treatment in our office. You mentioned it just so that they kind of understand the process. Once a patient has been consulted and then come in for a consult and deemed an appropriate candidate, the way it works is they come into the office and we've checked labs and our baseline requirements, and they undergo a mini liposuction because we're working with fat-derived stem cells, mesenchymal stem cells, as Anna mentioned. And then the mini liposuction can take as little as 20 minutes or it can take longer. If people have had liposuction before for cosmetic reasons, the fat can be harder to harvest, but we can still harvest it. It just takes longer. But usually a brief process done under local anesthesia, so much less painful than a bone marrow biopsy for people who are considering that as an option. And then patients go to lunch. We process the cells there in our office, and then a couple of hours later they come back and receive them in an intravenous infusion. If they have a joint condition, into the joint If they have a spinal condition, we're partnered with some pain management docs and ortho spine docs, neurosurgeons who can do the injections into the areas of their spine under fluoroscopic guidance to give the best safety and get the cells right where we need them. So for people who need just a one-time treatment, it might be just one condition. We did want to mention some of the contrasts and the different types of stem cells. People talk about bone marrow.
Yes, I have a lot of patients call in and they ask why are we using fat tissue versus bone marrow. Yeah. So bone marrow, as Dr. Askew mentioned, it's a much more painful process. You usually have to go under a full anesthesia. And
I would want it if I had to have a bone marrow biopsy.
Yeah, it's that painful. Yeah. We're also only harvesting about 10, 20,000, maybe a little bit more stem cells.
From bone marrow?
Yes, exactly.
You don't get as many.
And whenever we're going after mesenchymal stem cells, those fat-derived stem cells, which we usually harvest from the low back area, we get anywhere, depending on the patient, anywhere between 10 to 50 million.
That's awesome.
Maybe more. So we're really able to get a better quality and quantity of stem cells.
Absolutely. Bone marrow tends to, the stem cells in the bone marrow declines as we age and with illness. And so often the people who need these treatments are ill. And so fat, for good or for bad, most of us have got some fat to be harvested, less painful, better stem cells, and easier process.
It's a much quicker recovery. So we have a lot of patients that will call in and say they had a knee joint replacement or a hip replacement surgery on their right side. And they went through the surgery, so they were under a full anesthesia. They had 6 months to 2 years of physical therapy, intense physical and occupational therapy. So many patients will call in and ask, my doctor's recommending that I get a second knee joint replacement surgery, and they just don't want to have to go through the pain and the cost of it. So we can offer stem cells, since those stem cells have the ability to turn into those cartilage cells.
Absolutely.
And that they might be a better route versus getting a complete replacement and having to go through that long recovery, because with the stem cells, we're doing that mini liposuctioning, so it's just about a week of feeling a little sore, maybe a little bit of bruising, but one of our patients—
I can testify,
Yes, she got a pedicure while her stem cells were processing. I called her the next day, and she was shocked, and she's like, oh, I feel great. It's just a little bit of bruising at the site of liposuction, which is perfectly normal. And she's like, otherwise, I feel great. We had another patient we've had a few patients with knee joint issues, and they're not having to go through intensive physical therapy. They're able to walk. And so the body's really able to heal itself from the inside without manipulation from the outside world.
So for so many reasons, and I really think that the regenerative nature is the best, but from a standpoint of downtime, recovery, the possibility that they may not get the outcome that they had hoped for from a painful invasive surgery. I think this is an extraordinary technique, and we're happy to give you more information. Thank you so much for joining us, and I'm glad we got to share some information with you.
Absolutely, it was a pleasure.